Hello, I'm Dr. Timothy Tice. I'm a psychiatrist and planning to talk to you today about what's involved in a psychiatric evaluation. Persons come to see me with issues that may complicate their medical condition, such as anxiety, elevated mood, depression, um, disturbances in attention, in sleep, and various other problems. In a psychiatric interview, I typically begin by asking an individual to tell me about what it is they're concerned about. And then we explore together the nature of their symptoms, when they began, what the intensity has been, the circumstances in which those symptoms occur, and others who may have observed those symptoms and how they've affected the individual, how they've affected also the persons around them, how that person interacts with significant others and with such as family or friends, and how those symptoms may impact sleep, how they may impact their sense of physical well-being, pain, their emotional well-being, their ability to function in school or in work or socially. And after exploring the duration, the timing, and the various aspects of those symptoms, then we'll discuss what a likely etiology or explore what the reasons for those symptoms, what other factors might be involved as far as a person's physical health or different patterns of behavior. After learning about those presenting symptoms and what's involved in that for an individual, I tend to inquire about what a person's past psychiatric history has been. What other counselors or psychologists or individuals have they seen? Sometimes I'm the first individual they've seen, but often a person has seen someone else, if not at least their primary care physician, and have attempted to address the issues of concern with that individual. Upon understanding that past history and what's been done to try to address those symptoms, that also gives us important clues about how we might then look at and understand those problems and then address them perhaps in a different way, or maybe use some of the things that have been successful in the past and add to those things to help improve a person's condition. Next, it's important to learn about family psychiatric history. Often there are relatives who have suffered similar conditions or related conditions, and learning about what a person's relatives have encountered, what has been successful in helping those relatives, as well as things that have not worked at all for those relatives, it can often give us clues as to what may be helpful for the individual themselves. And then to learn about the medical history of the family, pertinent things that might be important as we consider various treatment options and might indeed complicate and have an overlay as to causing psychiatric symptoms among various different medical conditions. Then I inquire about the medical history of an individual and learn about the specifics of different things that they've encountered, prior physical symptoms, as well as perhaps surgeries, when their last physical exams and labs have been done, what the results of those various tests and surgeries have been, and understand how those issues may be impacting the individual. And then I'll inquire about nutrition and a person's habits. What do they take vitamins or medications? Are they consuming caffeine or tobacco, alcohol, street drugs? how those things might impact or be related to the concerns that a person has raised. And then we'll consider prior medication treatments. Often that's very important to understand the details of what a person has tried before, what their experience of medications has been. Many times persons have tried various herbal therapies as well, or tried vitamins, and things that generally may be helpful for a person also have the risk of causing important side effects. And we want to understand how those things may give us clues as to what kinds of treatments are most likely to be beneficial for that individual. Next, I'll inquire about developmental history. What were things like for the individual's mother while they were pregnant with that person? What were things like with the labor and delivery? The early development, were there normal developmental milestones? Did they sit up and walk and talk as they should? How was their learning through school? Are there specific learning disabilities that might be impacting their circumstances? And then I'll inquire about the nature of relationships with family members and significant others, particularly as one is growing up, and how that may give us clues as to perhaps symptoms started earlier than a person thought about previously, or there were other factors in the nature of those relationships that may be important in understanding a given individual. Especially issues related to trauma or abuse, things that can have a profound impact on a person and their life experiences and how they view their world. And then understanding a person from their social context, who they live with, the nature of the relationships they have with other individuals, what they have pursued educationally and vocationally, the kinds of things they enjoy, the ways in which they like to use their free time. Are there legal issues that may be involved in stressing them at present? Has there been military service and the unique and challenging issues that they may have encountered in that kind of activity? As well as, are there, what is a person's worldview? What kind of spiritual interests do they have? What is the cultural context in which their symptoms have been experienced, and how does that influence their seeking treatment, their willingness to accept various different types of treatment, or how they might prefer to approach treatment? And then finally, I'll ask a set of questions that often seem a bit unusual to an individual. It's inquiring about and trying to explore their what I call their mental status. What is the nature of their thought processes? Are they thinking in relatively concrete terms, or able to abstract well and think fairly fluidly? Have their symptoms impacted how they process information and describe the various different circumstances and providing the history they've provided? And then finally, we may close with providing treatment or symptom-focused physical exam, and often as matters involve psychiatric treatment, we want to know, for instance, what is a person's weight? Is that influenced by treatment, or is it influenced by the symptoms they have? Many times with psychiatric illness, a person may either lose their appetite or have an increased appetite, or find themselves gaining or losing weight. And so we want to put that into context with things, as well as things such as blood pressure and pulse, and understanding the capacity of their respiratory status and cardiovascular health and other pertinent things that might be involved in understanding the symptoms they present with. And finally, after doing that assessment, we'll consider together whether it's prudent or indicated to do additional diagnostic testing, or perhaps order some laboratory tests to see if there are chemical imbalances that might be influencing the symptoms at hand, and discuss what the patterns and the history that the person has just provided, what they indicate about what's likely happening, how they might fit in with the psychiatric issues that I'm familiar with, and whether there are non-medication, non-pharmaceutical related issues that might be changed, what kind of habits might be changed that might improve a person's condition, looking at things like sleep and improving sleep, exercise, nutritional issues that may be beneficial in diminishing their symptoms, and hopefully thereby limiting their need for medication. I'll make recommendations about psychotherapy and how that might help improve, or whether or not that's indicated for the condition at hand. And then finally discuss whether or not the side effects, the risks, the benefits that a psychopharmaceutical intervention, a medication intervention, whether that's worth considering given the intensity of the symptoms and how disabling they might be for a given individual, as well as the likelihood that those symptoms might continue, and the disability and trouble that might cause for the individual going forward. Thank you.
Medtwice.com